Okay, I'm going to turn it over to Dr. McDonald. By the way, Dr. Nicole Alexander-Scott feels great. She's healthy. She's just got a busy day today. And so we have Dr. McDonald.
Thank you, Governor Raimondo. Thank you. It's great to be here, and I just want to say good afternoon to all of our Rhode Islanders, everyone who watches us from beyond, and good afternoon to the members of the press. It's the first time actually seeing you guys in person. So I want to talk a little bit about the testing that the governor announced here a little bit today. So we do want anyone who has symptoms to be tested, and for that reason, we have a test site locator on the Rhode Island Department of Health website. I've used this today. I know it works, and it's pretty easy to find. So what you want to do is go to health.ri.gov, go hit the COVID banner. It's right there. You can't miss it. And then there's a little link on the side that says testing locator for the public. And then you just click that, and then there you go. And you put in your zip code, and it will show you the testing locations that are near your home. And I live in North Kingstown, so I put in 02852, and it worked out just fine for me. I saw quite a few sites pop up. Some of these sites are respiratory clinics. Respiratory clinics, you can do more than just get a test at. You'll be seen by a healthcare provider. So if you have symptoms and you need to say, well, I want to see a healthcare provider, and maybe your healthcare provider isn't comfortable seeing people who have symptoms of COVID-19 right now, then a respiratory clinic would be a great choice for you. You do want to call before you go to these places so you know that they know you're coming, and so you have an appointment for that. The locator is available in English and Spanish. And I want to thank Jay Metzger from the Rhode Island Department of Health, one of our GIS folks, who had a lot to do with that. I do want to talk a little bit about our data. Today is day 89 since patient number 1 in Rhode Island. It's day 151 for the planet. I keep track of the days myself because I have to have context on my own mind about where we are with this. So we have 124 new cases we reported today. There's 220 folks in the hospital, and 36 folks are on ventilators or breathing machines. And, we did lose 22 more Rhode Islanders, which that just is hard. And I know it's never easy to say that, but, we do know that every death is painful and it's personal. We feel very bad about this. And, as the governor said, there have been a lot of deaths in the state. That's one of the hardest parts of this pandemic, is just losing our loved ones and friends during this time. For the folks who did pass away, 18 were affiliated with long-term care facilities. 1 individual was in their 40s, 2 were in their 60s, and the majority of the deaths today were in the folks in their 70s, 80s, and 90s. 5 were in their 70s, 8 in their 80s, and 6 folks in their 90s. I do want to talk a little bit about youth and pick up on something the governor had chatted a little bit about. I'm glad that we're going to be doing some youth sports. I think it's important for kids to get outside and play and do things. Being outside is a wonderful thing to be, and it's, I think, in many ways protective. You get outside, you get your mind off of what's going on, and you do things that matter. I think kids like sports, they like routines. These things are helpful too. And this has been a challenging time for the younger friends. It's been a hard time for kids just in general. I think it's been hard for everybody. I think a lot of us feel like, we've been grounded and we don't really know what we did wrong, and I think it's just hard about the pandemic for our country. It's one of the reasons why I think there's so much of people having feelings the way they do, because the pandemic brings so much restriction to us. But I want to just have a little bit of a message for seniors and graduates a little bit, because 2020 has been hard for seniors and graduates, and this has been kind of a personal issue in the McDonald home. So the daughter is 18. Sarah is a senior and she'll graduate in a couple weeks. And one of the things I would tell Sarah is 2020 has been hard. It's been a year of shouldn't, a year of wasn't, and a year of can't. And those are 3 words that I don't like using in the McDonald family, because we're a family of can and do. And so much has been missed. I know for Sarah, she was going to go to Ecuador, week-long trip with the school, learn how to speak Spanish all the better. It was going to be great, and that got canceled. The senior prom was going to be a big deal with the boyfriend, and that was going to be exciting, and that got canceled. The pinnacle of the year for Sarah was the school was doing Hello, Dolly, and Sarah's into drama. And she actually got the role of Dolly. It was one of the happiest times I've ever seen her. And, when that got canceled, that was hard. There were tears. And part of why I share this with you is graduation's coming. It'll be a drive-through graduation, and that's really the smart way to do graduations, as a drive-through graduation, and that's going to happen. But 2020's been hard. What I saw, though, is, and I wanted to share this with us, too, is here's what I saw in my daughter. My little girl has become a woman, and I saw her handle this really quite well. And here's the things I saw. Adversity came her way, she moved on. Things that were well beyond her control, she learned to accept. The adversity and the out-of-control feelings, she's learned to process these feelings. And this is what adults do. And this is called resilience. In other words, we process bad things, we move forward. We try to find the silver lining even when there isn't one. We try to find a way to process our emotions and feel through the day. And resilience is really an important thing. And I think when we look at how we respond to the pandemic as a people, resilience is something we all need to display. And, you know, not everybody who's a senior or graduating has a mom or dad who can walk alongside them and process what has happened. And I think it's important, if you're that person in someone's life, you have that wisdom, that clarity of what's going on, can you walk alongside that graduate and can you give them some perspective on what's happened? In other words, that we've dealt with this adversity, we're dealing with this adversity, we're trying to demonstrate resilience. And you know, life isn't just cupcakes and roses as much as I want it to be for my kids. Life is processing these experiences and trying to find a way to process through it and grow as an adult. And I think it's important to do that.